I'm Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And I treat the whole body, but also spend a lot of time treating the foot and the ankle. And Rich presents with limited dorsiflexion, limited ability to pull the feet up. And here's my finger across, I'm walking across the big toe here, and you can see it doesn't go above this one. There's about a ½ inch difference in range of motion there. Now, we call that an anterior talus. He is stuck with the right ankle in a little bit more downward movement called plantar flexion, which reduces the upward movement called dorsiflexion. But it also restricts movement in the joint below the ankle, and that joint is where the talus bone joins the heel bone, the calcaneus. So it's also called the talocalcaneal joint. Now on his left foot, I can twist his heel to the left and to the right. I can also push the heel outward, and there's a fair amount of movement that way, and I can push it inward, and there's a fair amount of movement there as well. On his right side, if I try and twist his foot outward, there's really very little movement. And when I try and twist it inward, there's very little movement. And when I try and push it outward, there's very little movement. And coming inward, there's very little movement. It would be interesting to watch you walk and listen. Maybe you hit hard on this side because it doesn't accommodate. It's going to effectively reduce pronation, reduce flattening of the arch when you walk. And I can't get much flattening there. On the left side, I can get flattening of the arch, which is normal. So what I want to do is treat it, and basically what I'm going to do is mobilize the talus posteriorly. And when you do that, it's important to distract the heel away. So I'm pulling the heel downward and up. I call it a scoop because it's a curved movement, down and up, down and up. And then I walk down onto the talus at the end of the foot. I capture that with the heel of my hand, and then I just oscillate it 10 times. So that's a rather firm mobilization, and now your motion is equal. And now when I test rotation of the foot and ankle, that's freer. And now there's outward motion, which is eversion of the heel, and there's also inversion, is much freer. So you might feel a lot freer when you walk. I feel like the midfoot is still a little bit tight. Let's see how that compares to this side. There's just a mild amount of tightness. So I'm just going to pull the cuneiforms and the metatarsals towards the big toe. So I'm just going to capture that and pull it up. And I'm going to do that about 10 times. And after I do that 10 times, then I'm going to repeat that traction. I'm going to pull it forward, and then I'm going to twist it into pronation. So now I'm combining those two movements, and I'm going to do that 10 times. And then I'll teach you how to keep this movement. So once a week, I want you to have one of your strong boys test your ankle motion by pushing the feet up, okay? And if you do this for 4 weeks in a row and it's fine, then just test it once a month, okay? There's a good chance this will stay corrected. But have them push up on the feet, and if the right foot lags behind, it doesn't lift up as much, then you have them scoop the heel down and up. So you pull it away from the leg, okay, or towards my belly, and then scoop it up towards the ceiling. And then the heel walks down the foot onto the talus. At the very end of the foot, you just stop there, and it's a rotational movement. And I'll have you practice this on me and make sure you understand it, and then you can teach them how to do this.
Okay.
And of course, you also want to keep your heel cord stretched. So we'll review how to do the heel cord stretches as well. But that's how you free up the ankle joint to then free up the subtalar joint. There are cases where the ankle motion is normal, but the subtalar joint is restricted. And so for those cases, we distract the heel and twist the heel towards the other leg. So the foot goes outward, and we mobilize that 30 times. But in this example, the subtalar joint freed up in response to freeing up the ankle joint. So I don't see this really often. I oftentimes see locked subtalar joints. So it's a really nice video to have and share. And thank you for being the patient.
Thank you.